Hi, everybody. This is Dr. Keely Boyle again, hip and knee replacement surgeon, coming to you from Niagara Falls Memorial Medical Center and UBMD Orthopaedics and Sports Medicine. Again, these are meant to be educational videos with regards to information for our patients on hip and knee replacement. These are designed as a collaborative effort between UBMD Orthopaedics and Sports Medicine, as well as Niagara Falls Memorial Medical Center. We are launching a joint replacement program, and Dr. Nadzo and myself are really happy to be taking care of all of our patients up in the Niagara Falls region. Dr. Nadzo is currently there. He's seeing patients, and you can schedule an appointment with him now, or myself, I will be coming back to the Buffalo area from New York City at the end of August. And we will get into that a little bit later at the end of our educational session. So today is going to start a series on total hip replacement. So before, we had done some videos on is joint replacement right for me, and some other questions that came up that some of our patients may have had. So this next series is going to be on total hip replacements, and there's lots of questions about total hip replacements. In this session, we are going to be covering 3 questions. The first question of which is, how long do total hip replacements last? A common reply to this question is total joint replacements last approximately 15 to 20 years. A more accurate way to think about longevity is via the annual failure rates. Most current data suggests that both hip and knee replacements have an annual failure rate between 0.5 and 1%. This means that if you have your total joint replacement today, you have a 90 to 95% chance that your joint will last 10 years and an 80 to 85% chance that your joint total hip replacement will last you 20 years. With improvements in technology, these numbers may continue to improve and have improved tremendously over the past decade even. Despite such improvements, it's still important to maintain long-term follow-up with your surgeon to assure your replacement is functioning appropriately. The next question is surgery and recovery painful from a total hip replacement? Pain following total hip replacements has come a long way over the past 10 to 15 years, with increased use of regional nerve blocks, spinal blocks, and various other modalities used for pain control. Total hip replacement is generally considered to be less painful than total knee replacement. But again, we have made large improvements in total joint replacement for pain control for both total hip replacements and total knee replacements. Early range of motion and rapid rehab protocols are also designed to reduce early stiffness and pain, making the procedure in general much less painful than in years past. You may have relatively mild pain following the procedure, or you may have a more difficult time than others do. Everyone is unique and handles and perceives pain differently. So keep in mind that while pain management is greatly improved and pain-free surgery is unlikely, you may have a different experience than your friends, but overall, the recovery and pain following total hip replacement is completely manageable. You will want to take your pain medicines as directed by your surgeon, and those pain medicines can vary, and they can be anything from a very low-dose narcotic type pain medicine to Tylenol to really strong anti-inflammatories. And we try to use all these pain medicines in what we call a multimodal approach to pain management to help you through your recovery smoothly. The third question that we're going to be talking about today is the approach to hip replacement surgery. So you hear lots of people talking about approaches, anterior approach, posterior approach, lots of different ways to approach total hip replacement surgery. So we're going to talk a little bit about that. The way that a surgeon gains access to the hip during hip replacement surgery is referred to as the approach. There are various types of approaches named according to the direction that the surgery is performed. The most common approach today across the United States is referred to as the posterior approach. This is done from the back of the hip, Some more recent improvements to this approach, which include a smaller incision, less tissue trauma, have been called the mini posterior approach or other variants of that. Another currently popular approach is known as the anterior approach. This is performed through the front of the hip. Again, same as the posterior approach. There's been improvements to the anterior approach with smaller incisions, less tissue trauma, and with both approaches, the posterior approach and the anterior approach, sometimes they require special instrumentation that the surgeon orders to be able to do those types of surgeries through those smaller approaches, or what some other people call minimally invasive. So let's take a step back. There's pros and cons to every approach and every kind of surgery, and especially with approach to total hip replacement. And it's important to know that right now in our current environment, there's little science to endorse one approach being better than the other approach or significantly better than the other approach. Surgeons tend to have a preference and a comfort level with one particular approach over the others. Surgeons are trained in all sorts of approaches, but every surgeon has more experience with one approach than all the other approaches. The bottom line is that the best approach is the one your surgeon is most comfortable with to allow safe and precise implementation of your hip replacement parts or components. So have a conversation with your surgeon, and that should help decide which approach is best for you.